Hello and welcome to Wellness Waves on a Wednesday. I'm Donovan Broussard. I'm here with Tully Bennett, Director of Membership for City Club, and Dr. Katherine Strother, who's a board-certified family medicine physician specializing in the diagnosis, treatment, and management of acute and chronic health conditions. Thanks for being here. Can you tell us a little bit about yourself?
Absolutely. I'm a family physician. I was born and raised here in Lafayette and did my training in family medicine here at UMC, now UHC. I've been practicing family medicine in Youngsville for the past 17 years and just very passionate about meeting patients where they are with their health goals and kind of coaching them forward through whatever challenges they may have, or just prevention and being proactive with their health. So super excited to be here. We have 3 awesome kids. I'm married to Lance Strother, who is also very active in our community and passionate about health and living well, not just lifespan, but health span. So looking forward to chatting with y'all.
Awesome. I was looking over your talking points, and the first thing I came across, which was pretty interesting, was EESSS. Tell us a little bit about that.
Yeah, so I tend to be a little long-winded with my patient visits sometimes, and so I have to sometimes hold myself accountable with, okay, be concise, have a little takeaway that patients can remember. And I thought EESSS, sometimes acronyms or little mnemonics can be helpful for our brains to remember things. E for eating well. So, I mean, just the general tenets of healthy living. So, eating healthfully, exercise, sleep is so important. Socialization and stress management. I mean, so if I can kind of hit on those things or find out where someone may have a weak link in their life, we can focus on those. So eating healthfully, exercise, sleep, stress management, and socialization are the EESSS that I just try to hone in on for all my patients.
Sleep, very important. This week I've been struggling with sleep, man. I might have had 6 hours of sleep this week, just nothing, just crazy, not being able to get to sleep. I had to wake up super early one morning to go do something, and I just couldn't get to sleep. So, man, it just throws your whole week off.
Totally determines your day.
It really does. And sometimes it's, self-inflicted, right? We're so busy, we have so much to do. If I just get up a little earlier, if I stay up a little later, or sometimes you get in a groove or a flow, and next thing you know, it's midnight,
Right.
So it takes some, having a significant enough why to figure out the how. You'll probably hear me say that 8,000 times a day, but I think if we have a significant enough why to prioritize sleep, we can figure out the how. Okay, these are my guardrails. I'm not going to stay up past such and such hour. And then once I am in bed, having some of those sleep hygiene practices that are non-negotiable, like not having screens in bed, or even, I tell my patients, even things that are relaxing, like praying in bed. If it's praying for somebody you're worried about, that might activate your sympathetic nervous system and make it harder to fall asleep. So trying to do all the things that, kind of wrap up the day, not in the bed. Once you're in that bed, that's that sacred space.
Something that totally changed my sleeping patterns was not watching TV before bed.
That's a tough one.
A movie that was like stressful. You end up having dreams and you're not even getting that real deep restful sleep.
That's right. And duration of sleep. I mean, we have this mindset culturally sometimes, especially certain seasons of our life, where like the productivity and efficiency is everything, and so sometimes the answer to that in our minds, or in my mind, I'll speak for myself, is just cut out, let sleep be what suffers. But that's really counterproductive, because we all have experienced what it feels like to wake up more clear and cognitively.
You're lacking the quality of life.
After a better night's sleep, I just feel sharper.
Yes. Yes. I want to go back to when you said you spend a lot of time with your patients.
Yes.
That's awesome, to be personable with your patients, because a lot of time when you go to doctor's appointments and you wait forever, you talk to the nurse, then the doctor comes in for 2 seconds. 2 minutes, says, okay, look over your charts, for you to sit there and actually talk to your patients. That's really a good thing.
Yeah, well, I giggle a little bit, because I think down here in South Louisiana, at least me, as a, born and raised here, it's hard to say hello in 2 minutes, let alone do a patient visit in 2 minutes. But I do think I'm very grateful and blessed for a practice transition that I discerned and was able to make almost 2 years ago now. And it's the model itself allows for and is actually built around more time with patients and a more personalized touch. So that's been
And is that the MD
VIP,
that
yes.
you're talking about?
Yes.
And yes, I was hoping to hear a little more about that from you.
Yeah, so I work for Our Lady of Lourdes, and I'm part of the primary care physician group with Our Lady of Lourdes. And I have a unique arrangement where they have really supported me in affiliating my practice with MDVIP, which is a nationwide network of doctors who want to provide personalized health care, which allows for a smaller practice size, which in turn allows for longer appointments and really the advanced wellness program, which includes some tests that are above and beyond what insurance covers to really deep dive into cardiometabolic health prevention. The VIP always kind of rubbed me the wrong way a little bit. I mean, but when I learned that the VIP stands for value and prevention, I was hooked. I said, I got to learn more about this. There's just so much we can do if we're proactive and
I thought of it
preventive.
as like first class VIP.
Well, and we certainly want that feel for our
Right.
patients, no doubt, and so that's part of it. But the tenets of what MDVIP is all about, it's that value and prevention. And absolutely, I want every patient to feel like they're my only patient, and
Right.
and hopefully we're successful with that, especially with the awesome team I have at my office.
So the testing that goes above the insurance,
Yes.
is that like genetic testing or?
Not exactly. I mean, if genetic testing would be appropriate once we identify what the patient's needs are, I can order anything. But what's covered for the membership, with the membership fee that our patients pay to become part of the practice, comes a proprietary set of labs from Cleveland Heart Lab. It includes an advanced lipid panel,
Okay.
vitamin D level, uric acid, thyroid, metabolic
So why wouldn't
panel.
insurance cover that?
So if someone comes in without any, there would be certain diagnosis codes that would cover some of that, but not all of it, depending on if a patient has never been diagnosed with anything. Just for screening, many insurances don't cover things just for screening. And the blood work's not the only thing. I mean, we do spirometry, we do an EKG, we do an in-body assessment, which I know y'all have one here at City Club, which
We
is
do.
just a remarkable tool for, assessing body composition and, understanding where someone is and helping them map out goals for better body composition. We do hearing and vision. And again, you're right that some of these tests could have applicable diagnosis codes that we could, but to finesse that in a traditional practice and be that thorough without,
Right.
kind of a set aside. Almost, it has a feel of an executive wellness physical, and that we do still accept insurance for
Right.
if someone comes in with strep throat or a diabetes checkup or what have you. But for that annual wellness program with those tests, that's a separate fee that also allows
Sure.
for the patients who choose that model of care to be part of this smaller practice.
Gotcha.
I think it's beautiful how it's just not medicating, going straight to medicine and evaluating all aspects of a person's health and really
Yes.
getting to the core of the issue instead of just covering it up.
That's my aim.
I think that's the most wonderful part of the MDVIP program.
It really, that's my aim. It's if we can find a unifying diagnosis, it's so satisfying, both for the patient, which is the most important thing, but for
Right.
me professionally. And I couldn't do that without the team that I have and the support I have from both Lourdes and MDVIP and my staff at the office.
So I went to my
Without patients.
doctor, I guess around 6 months ago, and I guess they were taking my blood pressure, and it was a little elevated, but I think they were just the cuff was off or something. And I was like, man, my blood pressure's, I've been off of medicine for like 3 years. I said,
Yeah.
no, let's just wait. I'll start tracking it.
Sure.
What would you say if someone came into you with an elevated blood pressure? Are you gonna try and change their diet and health stuff for 6 months and track it before going to medicine?
I love that question because it is so common for patients to come in. The blood pressure is a little elevated, whether we call it white coat hypertension and
Right.
it really does exist, or whether it really is elevated and it might need some attention. Number one, I say this. I say your blood pressure is kind of like a kid's report card. We don't give one test and say, here's your grade for the year, right? A kid's report card is a an average of lots of quizzes,
Right.
assessments, in-class assignments, all those things. So data is so important to me, and the more data points we have, the more reliable the information is. So if you check your blood pressure and it's 138/88 every time you check your blood pressure, well, we've got some consistent data.
Right.
If we've got one time where and this happened this week with a patient whose blood pressure was 98/60 one time, and then 151/40, 151/90 another time, I'm going to be way slower at even making recommendations at all till I have more reliable.
Right. It seems a huge variation.
And
Yeah.
blood pressure does fluctuate. But anyway,
Right.
back to your question, I really believe that once we identify, is this really hypertension, or was it a one-off? Was it didn't sleep well the night before, you're stressed, the cuff didn't fit properly, all those
Right.
factors that play into it. But once we identify, no, this person has essential hypertension or hypertension period, then the obligation I feel that I have is to try to find a secondary cause. Do they have untreated sleep apnea? Do they need to lose some weight? Is their diet very rich in sodium? Are there some unforced errors like alcohol intake, or
Right.
things that we can work on from a lifestyle standpoint? Medicine has its place. I mean, no doubt there
for
are
sure.
patients with renal artery stenosis
Sure, yeah.
that don't need necessarily intervention procedurally, but may benefit from medication. There are certain people who have essential hypertension that aren't going to make the lifestyle modifications. So I'll take a harms reduction approach and
Gotcha.
use medication.
Now, if someone says, okay, I'm going to try a lifestyle,
Sure,
you
yes.
say, okay, I'll just track it. and-
Absolutely. And we have a wonderful tool within our electronic medical record if patients want to use it to enter their blood pressure data, and it comes to me in real time.
Really?
It's nice. Now, I'll tell patients that don't want to use the technology. You can write your numbers on a napkin and bring it to the office. I'll look at it. I'll look at your data however you give it to me, but I need the data. I need to see
So they're
those
actually
numbers.
tracking their blood pressure every
Yes,
single day.
Yes. Or every day to start, and then once we establish a trend, I mean, some people are creatures of habit, and if I don't tell them daily, they won't do it at all. And then
Right.
others feel tethered to a machine, and they feel old, and they don't want to do it. So I say, look, once a week, once a month, give me something
Right.
to work with there.
Now, those little battery-operated cuffs, are those accurate?
They can be accurate. I think with a properly fitting cuff, and with both feet on the floor, arm at heart level, sitting for a few minutes, not talking while the machine is working. And then what we offer to our patients, and not just me, I know a lot of my colleagues do the same thing, we will offer to patients, come in, bring your blood pressure cuff. My nurse, Amy, will check your blood pressure manually with the sphygmomanometer. That's the most accurate way to measure it. And then we'll take that off, check it with your machine. We should get within a few millimeters of mercury, systolic and diastolic. And then we can say, look, we can trust your machine. Because if I'm focusing
good
so
idea.
much on
That
data,
is a great idea.
if I'm focusing so much on data, and this data is going to affect treatment decisions, then I want to know that the tool we're using is accurate.
effective.
Let's go back to the in-body machine. We have one downstairs. I've never actually used it, but I hear a lot of people using it,
Yes.
and you like it.
I love it. That has really been a game changer in my practice. So in late 2023 is when I transitioned my practice to the MDVIP model, and that is part of the annual wellness program. It uses electrical impedance to measure weight and then break it down into the different types of weight. How much of our weight is water, how much of our weight is skeletal muscle, how much of our weight is body fat. And then, we can do some of the math, but it's nice that the machine does it for us, that we can figure out then percent body fat. And it graphs it in a neat way to where, what my patients and I will talk about aiming for that D shape. And what I mean by the D shape is when I plot weight, skeletal muscle, and body fat and draw a line between those dots, we want it to be a D shape, which emphasizes more skeletal muscle. It's hard to picture that on a podcast, but if we could visualize it, it would make more sense.
Just getting those levels correct.
Correct.
Good.
And that predicts better metabolic health, lower risk for things like diabetes, coronary artery disease, and better chance for longevity.
Right. And a great tool to track your progress.
Yes. I mean, for, not just women, but especially women, very focused on the number on the scale. And I love these stories of women and men too, who come in, see their weight, the same after all these efforts. But if I'm able to show them, no, but you lost 5 pounds
Right.
of fat, you gained 4 pounds of muscle.
I say that on my tour every time.
No,
I'm like, and there's the scale, but don't worry about that.
Right.
Fat, weight, muscle weighs much more than fat.
It's so true. And just to be able to watch the transformation, I mean, embarrassingly, and it happened when I was here for the health forum, I used y'all's, and I had lost 4 pounds of skeletal muscle. I said, no, this is time to step it back up and, hold myself accountable to the things that I'm talking with my patients about every day. So it's a motivator, especially, not everybody is like this, but some people are very motivated by their numbers, by their data, and having something trackable, I think,
Absolutely.
is a great resource. It can't be used for patients with implantable defibrillating devices because of because it uses electrical impedance. So that would be, the only contraindication to using it. But otherwise, every one of our patients that wants to gets on it, and we can use that to guide them.
I want to go back, and you said something about losing skeletal muscle.
Yes.
What's the biggest cause of that, in your opinion?
In my opinion, and again, I'm very evidence-based, so the literature may have a different answer, but I think probably the biggest cause is lack of exercise, sedentary lifestyle. I think other contributors are menopause, and the hormonal fluctuations for women, post-menopause, and then, low testosterone for men. I think that a diet that is not rich in protein will also...
Hear that a lot. Protein.
I often have members come saying that their doctors are sending them to the gym to use weights
Yes.
for that purpose.
So
Yes.
is weights going to keep your skeletal muscle more intact, or cardio? I mean, I'm assuming weights, right?
Weights more so, but both are important. I mean, both are so important. And I actually was looking at there's a neat app, if I can share about this. There's a colleague of mine shared with me just 2 weeks ago or 3 weeks ago about an app called Open Evidence. It is similar to ChatGPT, but for clinicians. You have to have your NPI number to get it, but it's mind blowing. So anyway, you can ask it different clinical questions,
Oh, wow.
and so I was using it today just to kind of get some fresh information in my head about what the literature's saying about exercise, and there really is an emphasis on both aerobic exercise and weight training. And again, I think it was one of you who said earlier about it was one of your other guests on the podcast who was saying about a patient's, what one of her clients' goals will really tailor what kind of exercise she recommends. And that would be the same for me. If someone has osteopenia and they want to prevent progression to osteoporosis, which is the medical term for brittle bones, then weight-bearing exercise, jumping, running, resistance training, weights, those sorts of things are going to be better for osteoporosis. Where if somebody really wants to lose weight, which you can't outwork a bad diet, but exercise, especially the aerobic type, will support weight loss through all kinds of mechanisms, not just burning calories, but the glucose regulation and insulin resistance, all that fun stuff that I like sharing with my patients about.
How much cardio would you want someone to do per day?
Per day, I try to frame it like per week.
Per week.
So 150 minutes per week would be goal.
I'm crushing that.
Yeah, there you go. Good job.
Crushing that.
That's
Dude, like
awesome.
2 hours of cardio a day.
That's amazing.
Yeah.
That's good. I am not an expert in exercise physiology, and I'd say this probably 10 times a day as I'm speaking with patients, that I'm on a learning curve. I think I'm a lifelong learner, and exercise is another one that I feel like I am on a learning curve on the specifics.
Right.
Is 2 hours of cardio too much? I mean, maybe for some
Probably.
people it will be. And then for others, that if someone's not doing anything and the word exercise makes them cringe, then I might change my language and I'll say, let's talk about some functional movement. Let's take the mulch from the truck to the flower beds. Let's, when you're standing at the sink, how about doing some toe raises,
Right.
releve. If you're a dancer, they'll know that term, or someone who just hasn't done anything at all, just put your shoes on and go walking.
Reasonable expectations.
That's a great way to
because
say
that's
it.
often the only way that some will get started.
Having a partner to keep you accountable. I'll give a shout out to my sister who just about every Saturday and Sunday. You want to go walk? You want to go run? And knowing that the invitation is open, from her.
Those are the two things that I always suggest to friends and families and members is that one, setting goals.
Yes.
And like times that you're actually going to commit in
Yes.
that week. And especially if you can do it with someone, that'll hold you accountable, make it more fun. You're getting the exercise and the social in all at one. Yeah.
You're
it's
speaking
great.
my language, Tully. That is so true. I think if it's on our calendar, we do it,
Yeah.
right? I mean, to the exclusion of other distractions. So that's another comment I'll make to patients. Look, if they're not exercising at all, I'll say, let's find one day. And if someone's a little bit overachiever, I'm like, okay, let's find 2 days. Take out your phone right now. Let's put it on your calendar. When are you going to do it? Where? And to the exclusion of other distractions or things that could come up. Make it realistic and write it down, And then if they do it, okay, well, 2 days a week is not enough, but at least they met that goal. Then we set another goal, and then we set
And keep
another goal
going.
and keep
Yeah.
going. There's only a few things that we can say we'll never regret doing, right? And exercise, I think, is one of them. And then I thought, well,
That's a good way to think about it.
unless you push too hard. I have regretted, doing a deadlift one time when it was too heavy and then I got hurt. But, other than those kind of setbacks, exercise, we might regret eating cheesecake and be like, oh, why'd I do that?
Right.
We might regret, overindulging with alcohol or what have you. But we won't. I don't think there's too many times where we'll regret exercising.
Not
Can
to
y'all
mention
think of a
the-
time?
The
Yeah.
dopamine and the
Correct.
Even-
Man,
The
just all the
results.
cognitive benefits, all the, just how good you feel after,
Right.
the way it helps with so many things.
I want to talk a little bit about the balance between aerobic and weightlifting resistance. For a long time, man, I just did cardio, 3 hours of cardio a day, right? Just barely any weightlifting. I ended up injuring myself playing pickleball, little spinal lumbar injury.
Okay.
So when I went to the PT, she's like, okay, you need to start doing more weights and squats. And like, I haven't done squats since like high school.
Right.
So in the last probably 3-4 months, I've really incorporated these squats and kind of not real heavy, but heavy enough to, put resistance. My body totally changed. I mean, some of the back pain went away.
That's amazing.
The lower body just feels so much stronger. So I've actually cut out quite a bit of cardio and put weight training in that place. And I mean, I feel like it's such a big difference. I guess that's just that perfect balance, right?
That's great. No, and I think for strength, you're especially core stability and squats can definitely, if you do
Right.
it in the proper posture,
Yes.
and you are
Because at first I
engaging.
feel like you've fallen over, so you have to make sure your back's has a little curve and you're going down and feeling in your legs.
Yeah, I mean, if someone's already kind of got their routine down where they've got 30 minutes 5 days a week or around that, then I'll encourage them to have that be 3 days of cardio and 2 days of strength training. But again, I'll individualize it. But in
Right.
general, I
In
think
general.
that kind of balance is good. And then if you're like me, I'm kind of a weekend warrior where I know that Saturday and Sunday are,
I am
I don't want to say for sure because there's always exceptions where I'll miss or not follow my own advice. But whatever days of the week someone's already working with, I'll try to encourage them to have that balance. So that's great that you're doing that.
What about rest days? And I'm asking for myself 'cause I don't really take many rest days. Usually, like on a Sunday, I'll maybe take a hour bike ride and consider that a rest day. Stay away from weight and stuff.
I think that's healthy.
It's fine.
I think that's very healthy. I think
Okay.
our bodies need that. Our minds need that. It allows for a variety of other wellness modalities. I mean, if you want to, meditate or, spend time in nature. I mean, there's other ways
Right.
besides exercise to engage good health. And
Just moving.
I mean, I would
exactly.
say as long as you're not using the same exact muscles strenuously
Correct.
over and over, I think as long as you're making variations, it would be fine.
So you're a runner.
I do like to run.
Yes.
How did you know that?
I didn't because you just said it. And I
Oh.
just recently gave up running.
So I feel a little hypocritical saying that because in junior high I played basketball and volleyball and softball, and I've always danced since probably first grade. But junior high I played all the sports. I love sports, but in high school I danced and.
Okay.
I still love sports. I still think of myself as an athlete, which my kids think is funny. But
There's a sport for that. It's called pickleball.
Oh, and I love that too. And listen, shout out to my in-laws. They're both 78 years old, 79 actually, as of yesterday. still playing pickleball.
Really?
Love it. They
Awesome.
introduced me to it. But anyway, so dancing has been a huge part of my life and movement journey, if you will. I find
that's fun.
exercise when it's fun. But then when I had our third child in '09, I felt that I needed a very practical, like step out the door with tennis shoes on kind of exercise. So I had never been a runner until 2009 when Gracie was born.
Wow.
And I put her in I bought a jog stroller. I put her in the jog stroller and just did the Couch to 5K app and did a 5K. Then I did a half marathon.
Oh, wow.
And then I did another half marathon. Now I have not done a half marathon in, probably over 10 years, but for me, my go-to, if I've been in a rut and I'm trying to get back into it, is just put my tennis shoes on, brisk walk, jog for a couple of minutes, walk again, jog for a couple of minutes, till I build back up to being able to keep up with my sister, who is consistent. Whenever I say I run with her, I actually chase her. That's what I do, because she's so much faster than me.
That's another thing I tell members to, walk as long as you can, run as long as you can, stop, take a break whenever you need. Intervals I think is a very helpful tool for people that are just starting out.
Well, and it feels conquerable. It feels doable.
Yes.
And it feels like, okay, wait, I did what she told me to do. Check. I was successful at that. And I think that when I walk, I try to be aware too of posture, to where I'm almost engaging my core as I'm walking. That allows for better SI joint stability, which so many women struggle with, and that's a source of low back pain. I have seasons of where I'm not doing anything, and that's embarrassing and humbling to admit, and I'm preaching to patients all day about it. And then I'll use this phrase a lot with my patients. I'll say, let this visit, they'll look at their numbers, we'll discuss everything. They're like, I know, doc, I know, don't fuss at me. So I'll never fuss at you. I'm going to meet you where you are, and we're going to use this visit as a reset button. So often we need those 3-month checkups or 6-month checkups to just reset. And if a reset means you went from doing nothing to now we're setting small goals, or if a reset is like, look how good I did, now let's reset, and set another goal.
So if a patient comes to you and they have great lipid panels, everything's good, do you see them in a year, or do you say just come back in 6 months, let's check back in and let's keep working on what your goals are? I'm always seeing them per year, and I just find that's not enough.
I encourage the 6 month for that type of patient you're talking about. Some people say, oh, well, could I just call you if I need? And I'll let them guide that. I mean, absolutely once a year.
Right.
But with what I try to do too, or at least offer, is with the MDVIP wellness program that I mentioned earlier, we offer that once a year. Their membership fees cover those services. So, don't, get what you paid for, come in for that. And then most insurances also cover a once a year wellness visit. So I'll encourage my patients to take advantage of that and see me twice a year. We'll do each of them once a year, but offset by 6 months, so that it's a natural 2 times a year check-in. And most patients take me up on that. There are a few that say, I'm good. Some say, I didn't join for all this wellness stuff. I joined so that I can have access to you. And that's fine too. I mean, everybody's got different goals, but I really like to offer what is available, which is my services that twice a year like that, or more if they need, or if we're following chronic conditions.
So how much do you use MDVIP in your practice? Is it like 100% all?
Yes. So to see me, I have had patients ask that, could I just come and not enroll? And right now the model is, my practice is just the MDVIP
because that's what
members.
you believe is most effective.
Yes, and it's just from an operational standpoint, it wouldn't be sustainable or fair to to have some doing it and not others. So
your practice is strictly MDVIP.
That's right.
Okay.
I'm still employed by Our Lady of Lourdes, so it's a unique relationship in that I'm part of the physician group. And in partnership with MDVIP, so it's kind of like a 3-way agreement that all of us have.
Gotcha.
So, yeah.
That's awesome. So we talked about how exercise is good for your body and strength. What about your brain? Tell us about your brain.
I love that. Okay, so I think that cognitive health and memory are becoming, very much hot topics, and the EESSS that we started the discussion with very much applies to cognitive health. What we eat, how much we exercise, sleep management, stress management, socialization, all that plays into cognitive health, but specifically the way exercise promotes memory and neuroplasticity. It's fascinating. There's a neurotrophin, which is a type of protein that is actually turned on when we exercise. It's called BDNF, brain-derived neurotrophic factor, and it is it's almost like for patients who care to hear that kind of stuff, it's fun to say, like, you have control to turn on this protein that's going to make your neurons like work better.
So many people need to hear that.
Yeah.
That is so amazing. That was what really caught my attention in your, for the health forum, was the details of the proof.
Yes. And,
amazing.
I think just increased blood flow, you mentioned earlier, the neurohormones that are, released when we exercise, it feels good. And then you're more cognitively clear. I mean, I can speak from personal experience that when, if I'm deliberating over a decision or feeling a little stressed, or I can tell that I'm overthinking a problem, if I just go walk real quick, like briskly, like, okay, well, that doesn't feel as heavy anymore,
Right.
and I'm sure I feel that whenever it's explained to me on a neurochemical level or a cellular level, I can understand it. I'm not as gifted at re-articulating it to you in this setting, but trust me, it's there. And I think BDNF has a lot to do with that, the brain-derived neurotrophic factor, the increased neuroplasticity, which is the ability of our brains to make new connections, and like I said earlier, increased blood flow, all of those things. That's pretty
Yeah,
amazing.
I kind of set my days up in blocks to where early in the morning I'll do an exercise. It's usually cardio or cycling. So it starts your morning off great. 1:30, I would go do a weight training or some more cardio, something like that. So the second half of your days should be decent. Then at the end of the day, I would usually do something. I'm usually playing pickleball or going do something else, kind of light. But I find if I miss any one of those three, maybe not the last one, but the morning or the mid-afternoon, like the rest of the day is just kind of,
Yeah.
it's not the same, especially the mornings, man. If I don't get up and do something in the mornings, my mornings do not run smooth. I mean, I'm kind of blah, kind of aggravated. So, I mean, it's very, very important for you,
And
your
if you've
brain
hit,
for sure.
If you've hit that stride with regularity, and
Right.
I would say that's unique. Not everybody has that. It's a common thing I hear about when you don't do it, you miss it. And
Yes,
I
you
think
feel guilty.
I think that almost somebody has to do it for at least 2 weeks, 3 weeks, probably even longer than that, for there to for you to reach that stride and then really miss it when it's gone.
Yes.
And so but that's great.
It gets to a point where you feel guilty if you don't do
Yeah,
it.
yeah.
It's like, why am I
But
feeling guilty about
some
this?
people feel guilty making that time for themselves, giving themselves permission, and I'm in that boat sometimes. I mean, as much as I'm talking about the utopia that MDVIP seems to be, it's not. There still are challenges and days where there's more work than time, and there still are days where, did I do everything I needed for my patients, for my family, for myself? And so to take an hour to go exercise might feel like a luxury, and we need I need to reset that framework, and not that it's a luxury, although it is a gift that we get to exercise. I
Right.
like the way Bailey, commented on that in a previous podcast, but that it's something we need to do for our health.
It's just trying to find that balance. I know, especially as a mother, that rings very true to me. Like feeling guilty about exercising, working out, but then, okay, wait, no, this is to be healthy for them.
Yes, and I think that going back to what we said about putting it on the calendar, if it's on the calendar, your spouse knows, your kids know where you're going to be. It's kind of like, this is what I'm doing right now. It takes away some of that, as if it's a luxury or an indulgence. It's not.
Right.
It's
And
part
setting
of-
an
For
example
life.
setting an example for the kids as well.
Great
A
point,
lifestyle.
Tully. Yes. No, I think my parents and my husband's parents, I mean, they really modeled what active living looks like, and putting us in dance and sports, and, being so supportive of just that active lifestyle. And now we hope to model that for our kids. So.
The one thing that we did not talk about, which is my favorite, is the social.
Let's go back.
I think we
We covered
kind of
that.
touched on that. Socialization
Yeah.
and the importance of that. It's my favorite.
Yeah,
I just
the-
think it gets missed
It
often.
does. It does. I mean, especially for our older patients. I'm sure here at City Club there are many, members who are, older and retired, and the socialization piece. I mean, so many people find their identity and connection with people through their work, and whether they're working or not, I think socialization is important. And just from a cognitive perspective, specifically going back to that, I think someone who isolates, who can't hear, who can't see, who's not moving, not socializing. I mean, there's so much less sensory input. So what do you think is going to happen? Just like our muscles, if you don't use it, you lose it. Same thing with the brain. You don't use it, you lose it.
Right.
So I have a patient right now who unfortunately does suffer with Alzheimer's dementia, and his family members, his adult children, have shared with me how one of their caregivers, who's just much more engaging and social, that he's actually improving because of the way this caregiver is engaging with him more each day. And I think that's beautiful,
Yeah. One of the most rewarding parts of my job here at City Club is watching our little family community interact. Even last night with watching the older community dance, laugh, and it just brings so much joy to me.
It does.
Because I know how healthy it is for them.
Yes, and we're made for connection. I mean, we're made for community. That's just the way God made us.
Mm-hmm.
It's a big social scene out there, and it's in pickleball.
Oh, yes.
I'll tell you that.
Yes. So my daughter, our oldest daughter, Maddie, just turned 22 in July, and she wanted a pickleball tournament for her birthday party. So we called it Dinks and Drinks, and I didn't come up with that, I'm sure, but she either came up with it or found it on Pinterest or something. But Dinks and Drinks, and so we went to a pickleball court and hoped that no one else would show up at the same time, and it was a ton of fun, and everybody could do it, and had a little breakfast and drinks for everyone. It was fun.
Yeah, I started playing about 2 years ago, and I had friends, but not a lot, kind of not as sociable. But man, since those 2 years of playing, I almost have 150 new contacts on my phone that says first name Pickle. And you go anywhere. I'm in a club, so I go play these teams. Just so many people in the communities there, and the social aspects there, and it's exercise. People aren't hanging around
absolutely
drinking. Most people are playing and working up a sweat and being competitive, and it's all ties into the exercise.
Yeah, well, and I feel like I talked about both my girls. My son, our son Landon, plays for UL. He is
really?
a redshirt freshman, walk on the UL football team, and speaking of social, sports, especially college football, what a social event that is. I don't know how much exercise we're going to get other than walking up the new stadium stairs,
right.
but just the, sports and staying physical, and how much that can be a, family affair and bring people together. So it ties in the athletics and the social all together. But
Yep.
Awesome, Katherine. Thank you for being here.
Thank you for having me.
Awesome. I'd like to thank Dr. Katherine Strother, as a board-certified family medicine physician specializing in the diagnosis, treatment, and management of acute and chronic health conditions.
Thank you
So
much
great to
for
have you on the show.
Thank you.
A pleasure.